Is it possible to predict the exact date and time of labor? I think most of the doctors and the parents would wish, but it doesn't happen in a normal delivery unless you're going in for an elective cesarean section when you choose the date and time. If your baby is still obedient enough to wait until that date, then it can happen. Can I have a natural birth after a previous cesarean section? Yes, provided you have had one cesarean section and the cesarean was not for a recurrent indication, which means if say you had an abnormal uterus and that's why you had a cesarean section, the chances of having a repeat cesarean section is almost 100% because there was a problem with the uterus or the pelvis. Again, if the previous cesarean section was due to something like the baby's position not being right or the baby was breathless, like fetal distress, then you can have a normal delivery. What are the benefits and risks of a cesarean section? The main benefit of a cesarean section is when your baby can't be delivered vaginally, it can be a life-saving procedure for both the mother and the baby. Apart from that, of course, if you're going in for an elective cesarean section, you're well aware of the time and date in which your baby is going to be delivered, so you are more prepared. And for patients who are very much afraid of pain and normal delivery, this is like a boon sent to them. Again, cesarean section is not without its risks. As with any other abdominal surgery, it has its own risks, especially increased incidence of bleeding and risk of infection, post-operative pain, the need for repeat cesarean sections and anesthetic complications, all that arise during your cesarean section as well. What positions can ease labor pains? So this is actually a difficult question. Pain is very individual, and so certain positions are helpful for certain people. Experiment with different positions is going to be difficult, but certain positions like sitting, kneeling forward, or having a birthing ball in the early labor, squatting position, all this might help ease labor pain. Should I get pain relief during labor? Again, pain is a very individual thing. Pain relief would actually depend on how much pain you are experiencing during your labor. How is the due date calculated during pregnancy? This day and age, we have so many apps for calculating the due date. However, if you still wish to do the old school way, then you can take your first day of last menstrual period and add on 280 days. So what you do is from the first day of your last period, you add on 7 days and go back 3 months. What happens if my baby is overdue? Overdue means your baby goes beyond the expected date of delivery, your pregnancy goes beyond that. So what happens when you're overdue is the placental function, the place from where your baby is getting all its nutrition, it starts dwindling. So it's not going to get enough nutrition. Studies have shown between 40 to 42 weeks, the risks for both the baby and the mother increases. And also the amount of NICU stay and the longer duration of hospital stay, including increased number of cesarean section, all that increases. That is why we are very hesitant to go overdue. What factors can cause a delay in labor? There are several factors that can cause a delay in labor, both from the mother's side and from the baby's side. If from the mother's side the contraction is not adequate, or if the pelvis is very small for the baby, then the labor might be delayed. From the baby's side, if the position of the baby is not proper, or if the baby happens to be too big, or it is not flexing its head properly, all these can actually cause a delay in labor. Is it safe to induce labor if I go past my due date? Yes, of course, you can't keep the baby in there forever, isn't it? So it has to come out either by induction or by cesarean section. That would depend on how favorable your cervix is and what position your baby lies. What are the common methods for inducing labor? The commonest ones are sweeping and stretching of the membranes, which means your doctor will have to do an internal examination and see if your cervix is open. They will gently stretch your membranes. That is the first step. They can actually rupture the membranes, which is called as amniotomy. If still it doesn't work, they might add medications like prostaglandins or oxytocin to increase the strength and frequency of your contractions. These are the common methods of inducing labor. Can you go into labor before your due date? Yes, most babies in fact come before their expected date of delivery. You need to know that your expected date of delivery is only a rough estimate. So almost 80 to 90% of deliveries happen before that. Will I need a C-section for twins? Nowadays, because of all the complications, increased risk of complications, many twins go in for a cesarean section, but it is not a must. Certain times when your twin pregnancy has progressed uneventfully and the first of twin is in the right position, you can still go through a normal delivery. What if the twins are in different positions? Actually, the twins need not be in the same position. The babies, still though they are twins, they are not going to come out at the same time together, isn't it? So each will be in a different position. The position of the first twin matters the most. Okay, so once the first twin is out, then the second twin is easier to deliver actually, if it's a normal delivery. But of course, it's a cesarean section, your position is not going to matter much. What is a birth plan and how do I create one? A birth plan is actually a written summary of your preferences, like in what position you want to deliver, who you want to be with, how often should the monitoring be, what medications would you need, what sort of pain relief, all this you put it down in a written summary. Keep an open mind. If complications arise, you might be advised to do things differently. So don't go on rigidly sticking on to your birth plan when it's not safe for you or your baby. What should I pack in my hospital bag for delivery? Like if you are going for any place, any travel, whatever you would require, your toiletries, your essentials, all that you should take. In addition, when you're coming to deliver, you need to have your hospital records and your birth plan if you've created one, your ID proof, and the baby essentials. Most often you forget the baby, so the clothing in which you want to receive your baby and your baby's outfits and maternity wears, maternity pads. Make sure you tick all the boxes in the checklist before you get yourself admitted for delivery.